Hi, I'm Cliff Gerber. I'm president of the Rotary Club in Shrewsbury, and we're going to be talking today about a project that Rotary has gotten involved with at UMass Memorial called NICView. I won't even tell you what that is right now. I'll let that evolve as our conversation goes on, but let me allow our other guests here to introduce themselves. To my left,
I'm Alan Piccarillo. I'm a neonatologist at UMass Memorial Healthcare in the Newborn Intensive Care Unit. Our NICU serves central Massachusetts and also northeastern Connecticut. We're the only regional NICU in the area.
I'm Roy Balfour, Rotary Club of Shrewsbury, and Assistant Governor for District 7910 Rotary.
I'm Bob Mangan. I'm with the Worcester Rotary Club.
I'm Brian Rourke. I'm an ex-president of the Rotary Club of Westborough and currently an Assistant Governor for District 7910.
Okay, well, let's start with Dr. Piccarillo. I declined to say what NICView meant, allowing you to do that and tell us a little bit about what that project is.
Sure, thank you, Cliff. NICView is a project that is really starting to gain an incredible amount of traction in Worcester itself in the Newborn Intensive Care Unit. What NICView is, it's a web camera. But it's a web camera that allows families to view their infants who are hospitalized in the NICU, and when the families have to, unfortunately, leave their babies in the NICU when they return home at night. So the NICU itself, as my colleagues here have visited and have seen, is a 49-bed intensive care unit. We typically have a census of about 42 infants at any given time. These infants stay about 3 weeks on average, so some babies only stay a day or two, but some babies stay up to 6 months. So I think we could all imagine how difficult it is for the families when they leave their infant in the care of, frankly, strangers. Even though the nurses and the doctors and the respiratory therapists, the entire staff takes these babies on and treats them as their own, it's still, we have to have a very large amount of trust with the families as they give us their babies to take care of while they're not there. So the camera system allows families to view their infants over any internet accessible device, whether it be a computer, a tablet, a laptop, even a phone. And when they view the babies over the internet, they can watch the babies for a few hours at a time at different times of the day. But it also allows extended family members to watch their infants also. So we have grandparents, friends, and family who are able to view their infant from far away. I know there's a map behind us and people are looking at that and may wonder what that means. But those are all the areas as of probably October where we've had people log in from and view their infant relative. As you can see, the top map is Massachusetts. We've had logins now from 42 different states, and even you can see there, we've had logins from different countries on every continent with the exception of Australia.
Roy, would you, do you have a comment? Am I cutting you off? You look like you were ready to say something.
No.
Okay.
What happened is that the Rotary organization became aware of this effort, which originally when we got involved had six cameras, kind of jury-rigged to IV poles, and unfortunately it was a share-less kind of issue. So what happened is we learned about the issue primarily because the Rotary Club of Worcester was looking to be more engaged in some of the surrounding community entities, and UMass was very helpful in detailing a number of projects that were basically unfunded by other projects. And let's just say it this way, UMass and UMass Memorial are large entities, and we all know that. And if we were in great economic times and they could trip over an extra $50,000 or $60,000, they'd probably do this project on their own. The reason why Rotary got involved is primarily because if we didn't get involved, there may be an opportunity for a family to miss that one-time, a lifetime experience with their child while we wait for the project to get funded. So the Rotary Club of Worcester was the first one to step up and engage in this particular effort. The members overwhelmingly looked to support the project, and then we basically started to spread the word. The Rotary Club of Shrewsbury got involved, and today we have about 8 Rotary clubs in the central Massachusetts area. That includes Worcester, obviously Shrewsbury, Westborough, Southbridge, Uxbridge, now Wachusett, and other Marlborough, and other clubs are like Sturbridge and others are coming on board to help this effort.
The Worcester Rotary Club's experience has been a great one and continues to be a great one. We see a lot of energy around this project for our club. As a matter of fact, Roy brought it to our club and brought us a list of projects from UMass, and our club voted that this is the project we wanted to work on. We saw a need in the community. We saw a great opportunity to help bring a tremendous impact to families everywhere that have children in the NICU unit over at UMass. And we just thought that, you know, moving forward with the project, getting some of these cameras purchased through the club, through individual donations, and through businesses. Frankly, United Lens and Southbridge Savings Bank stepped up to the plate, and they came through with a donation, and others saw that and are thinking about making the same type of donation.
You bring up an interesting point, and as the involvement of business, we're really here to talk about Rotary's involvement, but suppose someone representing a business that might be interested in participating in this and helping to sponsor a camera was moved to do that. How would they? What would they do? How could they go about that?
It's actually the steps are very easy, Cliff. And typically, all the funding is routed through the UMass Memorial Foundation. So when people make donations, they make donations to the foundation for the NICView plan itself. And one of the nice things that Roy was able to negotiate with the company was to allow for actually branding on the camera itself. So if people were giving in memory of someone who passed away or involvement of their company, they can actually have that imprinted on the viewing screen. So when a family member goes to view an infant on that donated camera, the image will actually say, this camera was funded by a donation through whomever. So it allows for not only you know, a great project and a great experience for the families, but it also allows for a longitudinal thanking of the people that donated money for the cameras.
That effort was also amplified by something that we all in Rotary know as the Rotary Foundation. So a lot of those donations that came in were matched by the Rotary Foundation to amplify the impact of the donors. So it became not only just a multi-club activity, but also Rotary International through its Rotary Foundation as well contributed. I think at the end of this program, the cable show will put a contact information point, but we encourage anybody who's listening to this program to contact their local Rotary Club, and they will help facilitate donations and provide the kind of recognition that Dr. Picarello was talking about.
That brings another dimension, and that is that individuals can also make donations.
That's an interesting point. Following the work that Roy and Bob did as an assistant governor, I have responsibility for several clubs in this district, and I took the NICView and I met Dr. Picarello, and I took the story out to my clubs, and the immediate recognition of the subject matter and its importance and the consequences is dynamic. As you said, people in the audience that you were talking to would have an immediate association, my daughter, my granddaughter, and it really is something that they can talk about. My over and above doing good things, I'm interested in the overarching well-being of Rotary and its growth and success and the happiness of the people that are in there, and they love to have something germane and close to home to talk about that reflects credit on all of us. And this does wonderful things, and it's great to be in there, but it's very easy to talk about and very easy to get somebody to say, here, have $1, let me help in some way.
It's a great local project too. I think sometimes in Rotary we think too big about things. We're an international organization, and we think about the third world and what can we do to help there, but there are needs here like NICView, and that's...
It's an incredible pairing, because we look at ourselves, even though the NICU itself is sited in Worcester, it is a regional entity. And it's nice to be able to pair up with different communities via the Rotary Club in all the areas, because again, Rotary is local, it's regional, it's national and international. So this has been an incredible synergy between the two groups, and we've been so thrilled with this partnership.
On the practical side of things, right now there's a need for 49 cameras, and at last count, we're still about 19 or 20 short. So we're hoping that the listeners, both other Rotary clubs, other members, individuals, and companies that would be considering involvement, just give us a call.
And the story picks up so nicely. We took the concept to the Milford Hospital, which is one of your satellites, and they immediately recognized the value of this, and we have a Milford Rotary Club that is kind of sister to the hospital, and I like exercises that get momentum, move quickly, you can measure it and reflect credit on everybody. This is probably the most fun that I've had as a Rotarian in a goodly while.
And one of the nice facts about that with Milford Hospital is the plans with the cameras now. So we transport about 120 infants into the NICU. So once they're born at a small hospital such as Milford, and the babies will actually be separated from the mother when they're transferred. If mother has maternal complications and she's too unstable to transfer, she actually has to stay away from her baby in a separate hospital until the time is right and safe for her to be transferred to UMass. And so one of the nice things about this program is, even though we call the families and tell them the baby's arrived and the baby is fine and everything's going well, we'll be able to actually broadcast the image of the baby back. So the mother who's at Milford will be able to have access to a laptop or a phone or any internet-enabled device and actually watch her infant at the other hospital. Again, it's not the same as being in the same room as your infant or touching your infant, but in this, it at least brings the baby a little bit closer and hopefully alleviates a little bit of the stress in an incredibly stressful situation for the families.
There's some positive experiences that you've done. I think the one I think of is the one where you had some twins born. They were to a Chinese young lady. Who, could you tell us a little bit about
that?
Yes.
So we had a family who the mother was actually traveling here, and the father was he's a professor in actually out west. And so they were separated, and she went into preterm labor and unexpectedly delivered a set of twins. So unfortunately, the father had commitments where he was working and couldn't travel to see the twins. So we were able to set the cameras up, and the family was actually the father was able to connect with his twins via the NICView system. And as it turns out, we haven't been able to confirm through our tracking system, but I believe the mother's extended family in China was actually able to log into the system at the same time and also watch their grandchildren. So it was a wonderful story. We have so many of those stories now. We have great stories of people who are deployed overseas. In fact, we've had logins from Army bases in Germany, from Coast Guard bases in Sitka, Alaska, and actually we even had a login from Guam, an Air Force base in Guam. And one of the really interesting stories that happened at the beginning was we had a relative that was deployed on a naval ship in the Persian Gulf, and they would actually be able to log in and watch their nephew. So these were all just incredibly great and heartwarming stories, and every week we hear about something else.
One of the feedbacks that we get is this is technology, kind of leading edge technology, and it's a little the beginning of the future. Images and information and knowledge get spread wider and wider at a very cost-efficient way of doing it, and there's an enormous amount of comfort for people in that.
There is. I'm a clergyman, and I've had some experience of dealing with families pastorally that have had to leave a child behind in the hospital, even in a situation where the mother either is in the same hospital or is able to go home and come back and visit. Even then, there are limitations. You know, every parent, I don't know if we're all parents, I am, and you all know that experience of getting up in the middle of the night and just going to make sure your child is breathing, you know, and you can't do that if the child is in a neonatal intensive care unit, but you can if there's a camera.
Exactly.
And building on that, one of the interesting things is we look at the data for the downloads. Probably about 80% of the viewings actually between 8 o'clock and 11 o'clock at night. So people go ahead and they put their baby to bed at night by watching them online, which is really, really, truly wonderful.
Yeah.
And then one thing I think the viewers need to understand too is there is absolutely no cost to the families or any individuals for this program. They can, once their baby is in the NICU unit, they can get an ID and a password, log in, and they can share that ID and password with friends and relatives from anywhere in the world. So if there's a grandparent out in California that wants to see the grandson or granddaughter in the NICU unit, they can log in from anywhere and on any device that's internet capable and actually see their grandchild, which is wonderful.
And even certainly even more practical aspects. For example, during the flu outbreak this past winter, the hospital had to restrict visitors. So they restrict visitors and actually would not allow for any children under 17 to come into the hospital to visit. And so we saw an incredible bump up over that month period in viewings, presumptively from siblings that were able to watch their hospitalized infant sibling. So from a practical standpoint, it worked out well for the hospital also, without removing a lot of the communication that would typically happen if the service wasn't available.
One of the things I was heartened by is that one of the businesses, Southbridge Savings Bank, for example, made a donation, and of course we used a district foundation grant to amplify that. But what was interesting is when they posted that they had done it on their face page, I guess they had a,
Yes.
how did it go?
They had over 163 likes on it, and then from there it morphed onto the UMass Facebook page as well. I'm not sure how many likes you got there, but it had all these stories below it, how people were touched by what the bank had done. And to that note too, United Lens also matched what the bank did. So you have two corporations right there that were proud to help out and make a contribution.
On the UMass page, when that was posted from Southbridge Savings, it was incredible hearing. Now, this program has really only been running for about a little more than a year now, in very limited capacity. But how many people knew about it and knew someone, either themselves had a relative who utilized the camera, or knew someone who had used the camera? And it was incredible because this was flying under the radar, certainly, but it was really, the momentum certainly continues to build.
With the openness of this and the connectivity advantages, the privacy of the children is still maintained.
Yes, so that was one of the struggles when we were first entertaining this a few years ago on how could we broadcast the infants to families. There were several layers with the hospital needed to be ensured. One was privacy, to make sure this was HIPAA compliant. Also, we had to have internet security compliant within the hospital, and this system met all the requirements, exceeded the minimum requirements greatly.
As a target, if you will, one of the reasons why we're trying to get this message out to the public is we still have 19 or 20 cameras to go, which is 19 or 20 families that aren't going to have this experience, that unless we move forward and continue our efforts, are going to miss that opportunity. So we highly encourage both the community and other businesses and other Rotary clubs to help us.
Yeah, I was going to say we have Rotary clubs that are still working on
Yes.
on this project, but there's plenty of room in the pool.
There's plenty of room in the pool, and the cost of the cameras is $1,200. It's a one-time donation to get that camera up and running and get the camera put in place. And the involvement of the Rotary clubs in our district so far has been very good. Clubs are continuing to raise money to help out in the project, and individuals are certainly stepping up to the plate to donate as well, which is nice.
And with the success that we've had so far has really been in quite a tight geographical circle, and we're going to carry on pushing it about. I mean, I know the next exercise for me is Framingham, Natick, and Franklin, and if anybody from those parts sees this, then we're on our way. You'll be hearing more about this, but we've only really touched a small corner of the Rotary that we're associated with.
And as Alan pointed out, the NICU unit serves all of Central Massachusetts, so it is.
That's an important message.
It's not just yes, it's a Worcester entity, but it serves all of Central Massachusetts.
Right. Our catchment area typically runs from east from Framingham, north up to southern New Hampshire to the towns on the border in New Ipswich, in that area, and all the way out west to Palmer, and south actually down through northeastern Connecticut through Plainville and Putnam and those areas there. So it's a very large geographic area of probably about 1.5 million to 1.75 million people. So it covers about 10,000 deliveries per year. So it's a very, very large area in a large geographic region.
Is this the one NICU in that whole area?
It's the only one.
Wow.
And the NICU itself was actually established in 1974. So they're coming up on their 40th anniversary in another year. it has grown in leaps and bounds since
Yeah,
1974.
I was impressed. I had been in the prior facility a number of years ago, an emergency baptism, and then when we got the tour, wow, this is a whole different world. Very, very impressive place.
Might be interesting to ask the question, as good and as helpful and comforting as this is, it isn't on the main channel of funding from the core business of UMass. It needs outside to actually be made to work. Would it ever become mainstream, or is this always going to be a...
That's a great question. I think typically the hospital, when they've raised money through different entities, it was typically for life-saving equipment. It was for the new ventilator, a new incubator, other equipment that would sustain life. This, not that it's different. You know, it's such a communication device, and I think it's just as every bit as important as a new ventilator. It's every bit as important as a new incubator. But until we raise that awareness about it, it will lag behind.
Doesn't fit the traditional categories.
Exactly.
Yeah, that raises a question in my mind. Who started this? Where did the idea come from, and how did it begin?
That's a great question. So it started out literally with Skype. So people have used, all of us that have used Skype before realize how wonderful it is. And if you haven't used it and you're in an area where, in the old days, I remember traveling in Europe and having to find a payphone and having to find the currency of that country and feed the money into the payphone. Well, as people have traveled, they realize all you need is an internet connection. And you can, with the voice over internet protocol, you can talk to people and view them just about anywhere. And so as this really had built up, people had asked the question, can we do it in the hospital? As these families are separated from their infants, can we do Skype in the hospital? So unfortunately, Skype did not fit any of the requirements that we needed for privacy.
Yeah.
It had an audio track, which was going to be a problem, and also it did not fit the minimum requirements for internet security. So we kept talking around, and it turned out one of the members of our information team in the hospital itself had friends who had twins in the NICU. And the twins, because they were different sizes, one went home a week before the other. And so this poor family had one twin at home, one twin hospitalized, and were trying to spread themselves between both babies equally. And he had asked that same question, is there a way to get Skype involved? And his name was Scott Romer. So Scott actually did the research, and he found this company in Kentucky, Louisville, Kentucky. And this company actually came up and did a presentation, and we had actually a very good working relationship. Now, the NICView system at the time was only in 2 or 3 hospitals. It was very, very new. And I believe now, Roy, you may know better, 6 hospitals are correct. And so it's something that we're hearing more and more interest in. And so we started, Xerox was very generous and gave us a very small donation and allowed us to have 6 cameras in the NICU. And as Roy had alluded to, they were jury-rigged to IV poles and swung back and forth to different babies.
Yes.
And the goal, as we saw in our pilot program, the reception from the families was incredible. That we thought maybe this is worth fundraising, and why don't we try to get a camera installed at every bedside so every infant in every family has equal opportunity to use the camera.
As people get used to this idea, is this a snapshot of the future?
I think it is. Our old studies would tell us internet access for our families was about 40 to 50%. But I don't think it ever took into account telephones. And most people now will look at the internet on their phone. So if you add the phone web-enabled phones in, probably it looks as though 80 to 90% of our families have some access to some internet device.
This is kind of the beginnings of the telemedicine era. And in this instance, I think you were explaining before the show began, that there's evolutions to this now that they're doing to the system so that the nurses can text notes to the family and communicate more than just a picture. And I think that's a great improvement.
Exactly.
Now, the cameras that are in there that will be installed are upgraded from the previous cameras from the beginning that you said that Xerox was generous enough to donate. And have those cameras been replaced as well?
So they're actually in the process. We have a prototype. So our cameras right now are typical web cameras that people may have installed at home. The new cameras are actually high def and low light. And the low light piece is important because we try to keep it, as you all saw when you visited, we try to keep the lighting down so as not to disturb the babies. It's not great for image quality. But the new cameras actually function better in low light, so the image quality, and they'll be in high definition, will be incredible. So we have our prototype camera that we're just getting used to now, and they're going to replace the 6 cameras we have through actually Roy's negotiations, and that will add to 43 additional cameras at all the bed spaces. One other thing I just wanted to say, that in addition to the NICU at UMass Memorial, the Pediatric Intensive Care Unit, which is on the university campus, is also looking into actually purchasing cameras, because the same rules apply. The families have to leave potentially their critically ill child in the care of strangers. So as they have seen our experience with it, they certainly are more interested in having that now in the pediatric ICU, which we're really supportive of.
So this learning curve that we're all going through now, this could be with us permanently. This could be with us a long time or permanently.
I can't imagine a point in time when we won't have this.
It's a lot of fun, and I have to say I thoroughly enjoyed visiting. And you have wonderful people there. They're a great credit to.
That's right. When Dr. Picarella says they treat them like their own babies, they do.
Amazing.
They do. You can see it.
Really
Yeah.
amazing.
I think the other thing that's very important is that if a company, entity, or Rotary Club is looking to make a donation, one of the things that Rotary is focusing on is when you make a donation to something, that it's sustainable.
Yes.
That it's not just something that's just come and gone. And so making donations to this particular project, as you pointed out, Brian, are sustainable. They will be with us for a long time.
Yes.
We'd help anybody that wanted to know a little bit more,
Yes.
as much as we possibly could.
I think our time's about flown, and we need to wrap this up, but I want to thank our guests and want to commend this NICView program to those who watch this.
Here in our newborn intensive care unit, we have 49 beds for infants that are born in our entire region of central Massachusetts and northeastern Connecticut. Unfortunately for most of the families, because of the increased length of stay for the infants here in the NICU, the mothers and fathers have to be discharged home from the hospital and go home without their infant. This NICView camera system here in front of me has allowed us to keep the families to have a link with their infants in the NICU itself while they're at home. This camera here is a wireless system, which we have 6 right now. It's located on a mobile pole. It can move from family to family, and it allows each of the families who are utilizing the cameras to be able to view their infant for periods of time while the families are at home or at work, or even extended families that are located in the next town from us here in Worcester, or in another state, and even other countries. The camera here is allowed to be on the infants for several hours at a time, and it allows for people to watch their infant sleep and feed and even be awake at some points during the daytime. We've had an incredible response from our families so far who have utilized the NICView cameras. We've had families who've had their infants as part of their bedtime routine with their entire family to watch the infant and put the infant to bed at between 8 o'clock and midnight and have that as their family routine. We've had other families who've actually been able to stream their infant at home through their large screen TV, so they have the infant present while the family eats dinner at night. We've had over 60 families have utilized this program just in the past 4 months alone. We've had logins from 80 different cities and towns in Massachusetts, 41 different states in the US, and actually 10 countries which span 5 continents. We're incredibly excited about this program. We're currently involved in fundraising. The fundraising, if people are interested in donating the cameras, the fundraising opportunities can be located at UMass Memorial Healthcare through the UMass Development Office, or we've had an incredible partnership with the local Rotary clubs in central Massachusetts. If people are interested or businesses are interested in donating to the NICView camera system, they can contact their local Rotary club, who has at times matching grants which can amplify the donation, or they can contact UMass Memorial directly at the development office.